Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rahban, and we're going to try something new. We've had a lot of people inquire about the current events and plastic surgery, that is plastic surgery in the news. So we're going to be doing a segment, hopefully once a quarter or once a month, regarding plastic surgery in the news. And we're going to be tackling and talking about the stories that you find and we read on the news regarding plastic surgery and sort of dive into some of the details. So hopefully you'll enjoy this segment, and let's rock and roll. So Maria, there was the one that's probably the most unfortunate and most tragic story is regarding, tell me a little bit of some people who had gone to Mexico and they had, there was a murder involved.
Yeah, it's really horrific. It happened about a couple of weeks ago. 4 people went across the border. To one person was going to get a tummy tuck, and they were going to do it across the border, and she had 3 people accompany her. Well, it turned out that rival gangs thought that they were really part of a gang of human traffickers. And so they started shooting them up, shooting their car. They stopped their car when they crashed, and they pulled them out. And it's all caught on video. And I think that's probably why it got so much attention, because someone saw it and started videotaping. Another tourist started videotaping it. And you see them being dragged out of the car and put onto a truck and thrown into, in one case, a person is thrown into the back of a truck and they disappear. I mean, immediately, there was a reaction from the U.S. The Mexican government got involved, and they found them in this house. 2 were dead. 2 were inside the house. The girl that was going to get the plastic surgery survived, was alive, and I'm sure that she's feeling guilty as hell right now. But 2 died, and so now everybody's questioning, why this happened, right?
Right. Okay. Well, so listen, what this highlights is medical tourism, right? The idea that you're going to get up, you're going to leave the United States of America, which, in my humble opinion, is the #1 country in the world for medicine. That doesn't mean that individuals in Germany and Austria, in China, in Israel are not brilliant and capable, but I don't think there's any other place in the entire world that has better safety and care for patients. So it's not just, and this tragic story exemplifies so many aspects of medical tourism. So, we talk about it on a regular basis. Now, plastic surgery happens to be one of the most common types of specialties in which people seek medical tourism. So first, let's define it. It's basically going to another country in order to obtain the same surgery that you could get in your country. Now, if you're going to do some incredibly sophisticated spine surgery, let's say my wife, who's been struggling with spine issues, finds this phenomenal surgeon in Germany, and we travel across the world in hopes of finding a cure for her condition. Totally understand that. You've exhausted all the possibilities in the US, you find a subspecialist in a country like Germany, and off you go. That I understand, but in plastic surgery, that is never the case. What is the common case in plastic surgery is, I want X. In many instances are things like BBLs, liposuction, tummy tucks, things of that nature. And I can't afford X in the United States, or at least not in the city where I want to be. So I think these individuals were from Florida, if I'm not mistaken. And so I don't know, I think it's alleged that she was going to get a tummy tuck or what, not the case. I can't afford it in my own country. And rather than foregoing it, meaning, well, just F it, I just can't afford it, I won't get it. It's not like you have cancer and you need a cure. Or, you know what, the hell with it, I'm going to save money, and while I want it this summer, it may take me 4 or 5 or 6 years to get it. Instead of those two things, these individuals, or many individuals, get up and go to these countries that lure you in and offer you the surgery at a fraction of the price. And not only is it at the fraction of the price, they also throw in a whole bunch of other shit, like hotel, a place for your family to stay. You're basically going on a vacation dragging a bunch of people, your family members, your kids, whatever, having surgery, recovering, and coming back to the US, plane tickets included, for much less money than the surgery that you're getting here. Now, there's a very famous saying, and the famous saying is that the famous saying is, if you don't pay a lot, you don't get a lot. You get what you pay for, kind of a concept, right? So if you pay a lot of money, you don't necessarily get a lot. But 100% sure, when you don't pay a lot of money, you don't get anything.
Yes. Well, here in this New York Times article, it cites that 92% cited lower costs in Mexico for going to Mexico.
No, there is nobody gets up and leaves the United States of America, which is the mecca of cosmetic surgery, to go to Costa Rica, to go to the Mexico, to go to Nicaragua, Venezuela, Colombia. No one gets up and leaves this country to go to these other countries because, oh, that guy is world-renowned. It's because it's cheaper.
And Mexico is the most common destination, by the way.
They're all the same. You are 100% a setup for failure. So here are all the issues with it. This tragic story is actually the least likely reason not to go to another country. The least likely reason not to go to another country is that you might be mistaken by a cartel and shot.
Yeah, who would ever say it?
This is a freak accident. But what is very common, is you go there and you have a complication. Either you have the complication there, which we had a guest on in one of our podcasts where they had gone for a BBL or something, had a stroke, and then ended up having to stay there for months. Family members had to go and medevac them and fly them here. Now she's in a vegetative state. I mean, horrific. Or you fly back to the United States, and then sometime shortly thereafter, you have a complication. You know how many people have reached out to my practice over the years asking for me to help take care of them? They're not my patients, but they have some kind of wound infection or a dehiscence, or their surgery opens up, right? And they're like, well, shit, I can't just fly back to Mexico or Costa Rica. And then now they're shit out of luck. You just don't go. The third reason you don't go to these countries is you have no legal representation. You understand? In America, there are 4 billion lawyers that are begging and waiting to sue a doctor. So you so much as blink an eyelash and say, oh my God, I got botched. And you'll have 45 lawyers who are willing to take your case for free. You have an issue in another country and you're fucked. You have no legal representation. There's no way to get these guys. There's no Yelp. There's no writing them up. There's no recourse. So while you could go to one of these countries and you could go get away with it, and your friends may have gotten away with it, it's just truly Russian roulette. And in my mind, there is absolutely no reason to do it when it's something elective. You don't have to have a BBL. You tell me I crossed the border because I couldn't afford chemotherapy. Tragedy. But I get it. You needed to, you had no choice. You had to survive. I would have been dead. But
you have to get medication, cheaper medication.
I understand. You need epinephrine. You need an EpiPen. You went to Canada. Got it. But you crossed the border to some remote area in the world to get a medical procedure at a fraction of the price, and you brought your family with you, and you come. What? You already know that's, and don't tell me you didn't know it's going to be risky. It just saddens me because it means that you have such a need for that procedure that you're willing to take this massive risk. And so in my opinion, there's never an indication for cosmetic surgery to leave this country, ever. And unfortunately, this case is just, it's super tragic because it wasn't even a surgical complication. It was like some freak misunderstanding or mistaken identity, so to speak.
Yeah, they confused them with a rival cartel, a rival human trafficking.
What are the chances of that? I mean, you might as well got struck by lightning. But it does highlight the idea of medical tourism, which I think is a horrible idea. Horrible.
Yeah, well, it's definitely gotten a lot of attention now with this incident. It's pretty sad, but it's sad to be a statistic.
Absolutely.
Well, when we come back, we have a couple more stories. We have the Linda Evangelista.
Sure, of course.
Situation, which, as you all know, it's been hitting the news a lot lately. Her problem with Coolsculpting.
Coolsculpting.
And then we also have Courtney Cox and Simon Cowell that have had their...
We call that filler fatigue. So you want to check out, pay attention. We'll be right back after this. Let's dive into a little bit more of current events and plastic surgery. All right, welcome back to the second half of plastic surgery in the news. We've been diving in. We just did a section on medical tourism and that tragic story. So there's been a lot of talk about, what's her name? Evangelista?
Linda Evangelista.
Linda Evangelista, supermodel. Wasn't she a supermodel in the 90s? Or what era was she in? Because she's about 50 right now, right?
Yeah.
So at any rate, the story with her is, she'd been hush-hush for very, very long time. And when you read her article, it shows you how something so simple. So, we often think of tragic outcomes in plastic surgery. They must be related to surgical intervention. And what's exploded over the last 10 years is non-surgical interventions, things that are spa-related, like as if it's nothing, like getting my nails done, right? Having extensions, and then going to a med spa and getting a bunch of procedures. They're non-surgical, so there must be nothing wrong, right? No,
right.
Obviously there isn't. So what she had done was Coolsculpting. And Coolsculpting is something I even offer in my office, but judiciously, very carefully, in the right patient. And what it is Coolsculpting is cryolipolysis, which means you freeze the fat. It's a technology, well proven. It's been done in hundreds and millions of individuals. Areas get frozen using these paddles. The area that freezes, the fat cells, more so than the muscle and the skin and whatnot, tend to be very sensitive to freezing point. The cells and liquid inside the fat crystallizes and causes the fat to rupture and then subsequently go away. Hence, you lose fat and shrink, whether it's your thighs or your love handles, etc. Very well established technology. Problem is, there is no such thing as a free lunch. None. You have Botox, you can drop an eyelid. You get filler in your nose, you can lose the tip of your nose and go blind. And with Coolsculpting, the problem is something called PAH. Paradoxical, right? Adipose hypertrophy. So let's go through these words. PAH. First of all, super rare. Just like when you get filler and you go blind, it's super rare. But it
says here the PAH is a rare side effect that affects less than 1%.
A lot of this data that we use, less than 1%, is reported by the company on very limited numbers. And while PAH, which I'm going to elaborate as people are waiting to hear what it is rare, it's not that rare. And I've had patients in my practice who have come to me from other places to be treated for PAH. So I think they way under-report their occurrence. It's still super rare, but it's not less than 0.5% And what it is paradoxical, meaning it's the exact opposite of what you thought it would be. Adipose means fat. Hyperplasia, which means thickening. So instead of freezing the fat and making it go away, the fat that gets frozen gets irritated, inflamed, and thickens and gets larger. That's right. Rather than the fat going away, it gets larger and harder and becomes like a kind of like a rocky or firm area.
Yeah. She refers to it that it's like a rock that on her arms they rub and it's painful. She gets even blisters because they can't rub it so hard.
Right. So fat is generally soft. And then once this PAH occurs, that fat becomes scarred and becomes thicker because it's inflamed, and it becomes firm and hard. And it's very, very difficult to correct. And so what happened to her is she went in and did this Coolsculpting, which again, millions of people have done. I have it in my office. It's a very safe procedure, but it is not without its issues. And what she got, which she got a lot of it, is that she got this PAH occurrence throughout her body, hence creating lumpiness, bumps, and all kinds of, we call hypertrophy, meaning largening of these areas. And as you can read in her article, she's devastated. She stayed indoors. She couldn't wear she was wearing turtlenecks.
This lady was the queen of runway. She was
right. She became depressed. She was hidden. she wouldn't come out until she had this most recent reveal where she started to talk about it and kind of shed herself of all the guilt and whatnot. The treatment for it, or at least the attempted treatment, is to go with a liposuction cannula and try to actually now suck out the fat rather than use any device. What's the moral of the story? What's the moral of the story? The moral of the story is not don't do Coolsculpting because you get PAH, whether it's 0.5% or 1% or 2%, it's still incredibly rare. The moral of the story is that every goddamn procedure you do, everything you do has a consequence associated with it, and you must at least be aware of it. What she writes about and why she was so pissed is it wasn't like they said, hey, Coolsculpting, great technology, yada, yada, yada. By the way, you could get this super rare thing called PAH. And she said, how common is it? And they said, it's pretty rare, which it is. And she said, yeah, you know what? I'll take it. I'll take my chances. And then she got it. It would suck ass, but she would have been aware and what's called informed. What she's very upset about, aside from the way it's impacted her physique and her body, is that she was totally unaware of it. Now, I don't know that it, with all honesty, would have made a difference. I think she would have done the procedure anyways, and I think she's just very unlucky. Like, they claim it.
My question is, okay, so let's say you have no way of knowing if you're going to have a reaction to this. Then why did she do it to her whole body?
I think what she did is that she did multiple rounds of Coolsculpting on her arms, her thighs, her legs, her abdomen, and this takes a while. And this takes a while. This takes a while. It isn't something that happens like, oh, I did Coolsculpting and I burnt my face, like during the session. This takes months to develop. It's a reaction. It takes months. So I don't think she had any clue. She certainly didn't get it and then go back. So the moral of the story is it can happen to anyone. It happened to a supermodel. It can happen to anyone. Doesn't matter if you're poor or rich. And it can happen with any of the stupidest little procedures. Literally, you could go into a spa, get filler injected in your laugh lines, and go blind. My biggest pet peeve is everything is so goddamn fucking casual. Oh, it's no big deal. It's plastic surgery. Yeah, whatever. And again, most people do well. But there are complications. And this is a perfect example.
They're always risks.
I'll give you an example why. People come to me all the time and say, hey, Dr. Rahban, you do this amazing plastic surgery. Could you take this mole off? Mole. It's a goddamn mole. And I look at it and I hem and haw and I'm like, I don't know. It's in the middle of your chest. It may leave a ugly scar. It may become hypertrophic. It may get red. It may get brown. And they're looking at me like it's just a mole. But do you know how many people in 20 years I've taken care of who've come to me with a single stupid little mole that was removed by a dermatologist that has turned into something the size of a golf ball as a result of poor scars? Women who have it in the middle of their chest. Do you understand? A woman came to me. She said, I had a goddamn freckle between my breasts. I went to a dermatologist. They said, well, I don't know, blah, blah, blah. It's changing color, blah, blah. We should biopsy it. Fast forward 4 years later, 3 revisions later, it's the size of a golf ball. She can never wear a bathing suit again. It expanded. It got hypertrophic. The scar got thickened. She got a keloid from a freckle. Oh my. So that is not unusual or rare. So when people come to me like, hey, will you just take this mole off? I always stop, contemplate, draw them pictures. I tell them, I don't know. You got to be, because there is no free lunch. You just need to be informed and make a good decision. At the end of the day, you get in a car every day, and yes, you could get killed by a drunk driver. There's people all day long, all over the world that are driving just to work and somebody careening through them and kills them. Doesn't mean you're not going to drive the car. It just means you're aware every time you seatbelt that someone could kill you. You just need to be aware. That's all I'm telling you. Anyway, that's her story. PAH, rare, but definitely not unheard of.
It really scary because, to tell you the truth, before this article came out, I would see these things that are done, in the office, and like Coolsculpting or what's the one of the chin?
Kybella.
And things like that. which every time I go to the dermatologist, she'll say, do you want to do the Kybella or whatever? And I go, no, it's fine. But to me, before, I would always be curious and say, oh, why not? Let's try it, because I never thought of the consequences. And now when this comes out, I go, oh my God, even for this, there are consequences. I mean, it's scary.
The point isn't to stick your head in the sand and not do anything because, oh my God, God forbid, God forbid, God forbid, God forbid. I'm not here, but I am.
Go there and have your eyes open.
Yeah, I mean, at the very least, don't get up. Not that she did, but at the very least, don't get up and go to some goddamn, spa in some strip mall. You know what I mean? Just be smart. All right.
No, but what's a lot? This is a perfect example that it can happen to anybody, anywhere. It doesn't matter you're rich or you're poor or whatever. In the hurricane, I doubt, like you said, that she went to just any shopping center and did anything. So her risks were minimized, but still, it happened to her because her body reacted to it. Well, the next story was that I thought fascinating was both Courtney Cox and Simon Cowell came out recently on People magazine talking about their fillers and how base and how they've decided to stop using it. And I've been hearing that more and more, people talking about eliminating their fillers. And,
So this is something absolutely not new or, oh my God. It's so funny because it's like Simon Cowell and Courtney Cox come and we're going to cold turkey stop filler. It sounds like they've like had a drug addiction and they're coming out and like talking about how they've been heroin addicts and they now are not going to use heroin. The irony is the same shit. So let me explain to you how this happened. This is called filler fatigue. Filler fatigue. And what it is and how it happens, and it doesn't only happen to celebrities, it happens to so many people. I would say the majority of people getting filler. You go in, you go see your doctor, and at some point you enter the world of filler. Filler in your cheeks, filler in your lip, filler under your eye, filler in your chin, filler. Again, no problem there. Filler's a great product. It's awesome. If used correctly in the right patient, it's unbelievable. You get it done. You go, wow, I look better. That's awesome. Then you circle back to your doctor again and pay attention here. This is how this happens. You go see your doctor. You are an untrained eye. All you know is when you did it, it looked better. You think that it's gone, and it's not. And you ask your doctor, hey, do you think I need any more filler? And they say, yeah, it's been 5 months. And you put more in again. And then you go away. And then you come back 5 months later. You say, God, I think it's going away. And do you think I need more? And they say, yeah. And next thing you know, without you knowing it, because it's gradual, you're unrecognizable to friends and family. And people look at you who know you and be like, what happened to Maria? She looks weird. Why does she look so old? What's going on with her lips? What's that swelling under her eye? You don't know shit because it has happened so gradually. Why does this happen? Because you go in, you take 5 steps forward with a filler. When you go back, you've gone 2 steps back, but you still have 3 steps that are still there. Your greedy little spa doctor, and by spa doctor, it could be your dermatologist, plastic surgeon, rather than looking, you go like, no, you're fine. This lasts like almost a year. They stick another syringe in you. So now, 5 steps forward, 2 steps back, 5 steps forward. Now you're 8 steps forward. You wait, you come back, 2 steps back. Now you're 6 steps. You add 5 more, you're 11 steps forward. So instead of going 5 forward, 5 back, 5 forward, 5 back, always being around 5, you're already 11 steps forward. Who's to blame? The goddamn practitioners. They're the trained eye. They're the one looking at you going, whoa, you're looking swollen. Wow, that puffiness under your eyes. But they're greedy. And what they should be doing is what I do in my office on a daily basis. People come in, they come in for their Botox, which wears off in 4 months. That's very quick. And they always ask me, hey, doc, it's been a while. What do you think? Do you think I'm ready for filler again? And I look them dead in the eye and I go, nope, not at all. You got time.
There's no doubt that you're pretty straightforward about your business.
Yeah, you got some more miles on those brake pads. You can get another 10,000 miles out of those brake pads before you need to swap them out. The patients don't know any goddamn better. They look in the mirror. I don't know. Do I look better? I think I look better. but they rely on and so who notices this? Friends and family who see you in weird. So the reason Courtney Cox and the reason Simon Cowell came to this realization is because their publicists and the media were writing. I remember exactly it was all over the internet. Oh my God, what the hell did Simon Cowell do? He's unrecognizable. And
especially around his eyes.
Because they filled around his face and his cheeks and you just don't understand. You just keep all of these celebrities are the same as you and me, and that they gradually get filler fatigue. And it takes a horrific photo of themselves by the paparazzi for someone close in their circle to be like, bro, you got to look at yourself. This is ridiculous. Holy shit, I look terrible. So they both came to that realization, of course, independent of each other. And they both came out and said, listen, we realize we're starting to look unrecognizable and we're going cold turkey, AKA I'm not going to be doing heroin anymore. And that's the case with regular people. That's why when you tell someone who's never had filler before, you ask the average person on the street, what are your thoughts about filler? Oh, whoa, wait, no way. You're going to look like one of these weird celebrities. You see, it's been associated with that because of the handful of shitty outcomes, because it's so obvious. You see it like they look like weirdos. Everyone had that person in their circle. Their friend, their mom's friend, the coworker, the girl in school. Someone always knows someone who's gone too far. And that person is totally oblivious. And that's a problem with these spas. And I say spas, but it's doctors, practitioners, nurse injectors. And the other issue is when you want to go get a nose job, you have to go to a surgeon. So there's a handful of surgeons. Some are plastics, some are weirdo surgeons. We don't know what they do. But at the end of the day, it's a finite number of surgeons. When you want to go get filler, it's anybody. Do you understand how many people can inject you with a syringe of filler? Nurse practitioner, PA, pediatrician, ER doctor, OBGY. I know someone who's an ER doctor who's injecting fillers. So it's not illegal. They're doctors. They're just injecting. So the difference with surgery is that at least you have to be a surgeon. With fillers and Botox and Coolsculpting, it's any asshole. Anybody can do it. So you shouldn't be surprised that there's a lot of weird people walking around. All right?
And you know that, by the way, in cruise ships, they do the fillers.
Yeah, of course. It's a moneymaker, baby. They want to do it in malls. They want to do it in cruise ships. It's just like nothing. It's like, I'm going to go in, blow dry my hair, do a little massage, facial, cucumber scrub, and put some filler in my face. None of those things can make you blind except for the filler.
Because I was walking by and this lady says, oh, I work at the salon or whatever, and I can do your lips because I guess I have some lines on my lips. She goes, I can fix that for you. And I go, if you show up on this podcast and you look like a duck, you're fired. I will kill you. I'm too much of a chicken shit. That's the journalist in me that has seen all these stories and I get spooked out of all these things. No,
I'll fly to Miami and kick your ass, okay?
No, that will never happen. I can guarantee.
All right, guys. So that's that's you definitely need the Botox. That's a wrap. We're going to try to do this on a regular basis. Hopefully you like this segment. We're going to do plastic surgery in the news. And as always, thank you for joining us on this episode. If you like our show, you find it interesting, fascinating, educational, whatever, do me a favor. First thing you do, go write something nice. We love when you guys give us positive feedback. If you have nothing nice to say, don't write anything. Just go away. Share and subscribe. Tell your friends about our show. We love having you. And then until next time, I'm signing off, Dr. Rahban on Plastic Surgery Uncensored.